Hypertension. High blood pressure can go unnoticed for years, and uncontrolled blood pressure raises the risk of significant health problems including heart attack and stroke. High blood pressure is a long-term condition that affects practically everyone at some point. Fortunately, the sickness is easily detectable, and it may thus be managed with the help of professionals. Adults are more likely to have high blood pressure, but children can be affected as well. Some children develop high blood pressure as a result of kidney or heart problems, but a growing number of children are vulnerable to high blood pressure as a result of poor lifestyle behaviors such as poor nutrition and lack of physical activity. High blood pressure comes in a variety of forms. There are two types of high blood pressure, systolic and diastolic. 1. Significantly elevated blood pressure. This type develops gradually over several years in 90% to 95% of instances in adults whose cause is unknown. 2. Hypertension due to a secondary cause. This type is formed in the remaining 5%-10% of people as a result of another condition, and it usually arises quickly and generates blood pressure that is greater than the primary. High blood pressure symptoms. The majority of people who have it have no symptoms of high blood pressure, which is not the case in cases where high blood pressure is harmful. The following symptoms may emerge in the early stages of the disease in some patients. Headaches that are not very bad. Dizziness. Constant nosebleeds. However, these signs and symptoms usually arise when the disease has progressed to the point that it is life-threatening. High blood pressure causes and risk factors. The following are some of the reasons and risk factors for high blood pressure. 1. High blood pressure causes. The following disorders and drugs are among the leading causes of secondary hypertension. Kidney failure. Adrenal tumors are a type of tumor that develops in the adrenal gland. Heart abnormalities that are present at birth. Certain medications, such as contraceptive pills, anti-inflammatories, and congestion relievers. Pain relievers, both over-the-counter and prescription, as well as a variety of prescription drugs. Cocaine and amphetamine are narcotics. 2. Risk variables that are beyond one's control. Many variables, some of which are uncontrollable, increase the chance of developing high blood pressure, including 1. Your age. As people get older, their chances of contracting the condition grow. Men are more likely to get the condition in their early middle years, whereas women develop it after menopause. 2. Your ancestors. High blood pressure is often passed down through the generations. 3. Risk variables that are beyond one's control. The following are some more risk factors that can be managed. 1. Obese or overweight. The higher the amount of blood flowing in the blood vessels, the greater the pressure on the arterial walls, and the heavier a person is, the more blood he requires to transport oxygen and nutrients to the various tissues of the body. 2. Insufficient physical activity. People who do not engage in physical activity have a faster heart rate than those who do, and the faster the heart beats, the more effort the heart must perform at each contraction, increasing pressure on the arteries. Lack of physical activity also raises the risk of obesity. 3. Tobacco use. Tobacco use causes an acute and transient elevation in blood pressure. Furthermore, the chemicals in cigarettes may cause damage to the artery walls, causing the arteries to narrow, resulting in high blood pressure. 4. Feed with a lot of salt. A diet heavy in table salt can increase fluid retention in the body, which can lead to high blood pressure. 5. Nutritional deficiencies in potassium. Potassium helps cells maintain a healthy salt balance. Too much sodium can build up in the blood if not enough potassium is taken or stored. 6. Vitamin D deficiency. It is unknown whether a vitamin D deficient diet can produce high blood pressure. Vitamin D is thought to impact a kidney-produced enzyme that controls blood pressure, according to researchers. 7. Consuming alcoholic beverages. Alcohol consumption can cause the production of hormones that produce high blood pressure and a rapid heart rate. Tensile force. Stress causes a transient rise in blood pressure, but attempting to relax by overeating, smoking, or drinking alcohol can exacerbate blood pressure problems. 9. Long-term illnesses. Excessive blood pressure is linked to a number of chronic conditions, including high cholesterol, diabetes, sleeplessness, and kidney disease. Pregnancy is number 10. High blood pressure can sometimes be caused by pregnancy. High blood pressure complications. Excess blood pressure on artery walls can harm blood vessels and other organs in the body. The higher the blood pressure, the more damage is done. If high blood pressure is not treated, it can lead to an injury to the blood vessels. Localized dilatation of blood vessel walls. Cardiac arrest is a condition in which the heart stops beating. Blood vessel blockage or rupture in the brain. Kidney blood channels become weakened and narrowed. The blood vessels in the eyes thicken, narrow, or rupture. Issues with memory or comprehension. High blood pressure is diagnosed. The amount of blood pumped by the heart and the level of resistance to blood flow in the arteries define blood pressure. The higher the blood pressure, the more blood the heart pumps and the narrower the arteries become. Measurement of blood pressure. Blood pressure is measured using a specific gadget that consists of an inflatable bracelet worn around the patient's arm to detect and treat high blood pressure. Measurement of blood pressure. Blood pressure is monitored using a special gadget that consists of an inflatable band put around the arm to restrict blood flow in order to detect and treat high blood pressure. The measurement's results are expressed in millimeters of mercury, and they contain two numbers. Systolic pressure is the pressure in the arteries when the heart muscle contracts, and it is measured by the first or higher number. The diastolic pressure, which is the second or lower value, measures the pressure in the arteries between beats. Measures of blood pressure. The following are the four types of measurement values. Normal blood pressure. A blood pressure of less than 120/80ths of a millimeter of mercury is considered normal, while some doctors believe that a blood pressure of 115/75 is ideal. When the systolic pressure is 120 to 139 millimeters of mercury or the diastolic pressure is 80 to 89 millimeters of mercury, you have pre-hypertension. The first stage of high blood pressure is defined as a systolic pressure of 140 to 159 millimeters of mercury or a diastolic pressure of 90 to 99 millimeters of mercury. The second stage of hypertension is defined as a systolic pressure of 160 millimeters He or a diastolic pressure of 100 millimeters He. Although the highest and lowest blood pressure readings are essential, systolic blood pressure becomes more important beyond the age of 50. Systolic hypertension is characterized by a normal diastolic pressure but a high systolic pressure. In persons over the age of 50, this is the most frequent type of high blood pressure. Treatment for hypertension. Although lifestyle adjustments can substantially assist in controlling blood pressure, they are not always sufficient. The doctor may recommend drugs to decrease blood pressure in addition to physical activity and dietary changes. Treatments for high blood pressure. A doctor's recommendation for high blood pressure treatment is based on the patient's blood pressure level as well as any other medical issues he or she may have. The following drugs are suggested. Thiazide diuretics are a type of diuretic. Beta blockers are a type of medication that prevents the body from releasing. Inhibitors of the angiotensin converting enzyme. Blockers of the angiotensin II receptor. Calcium channel blockers are a type of drug that works by blocking calcium channels in the body. Renin-angiotensin-aldosterone receptor. In circumstances where high blood pressure cannot be controlled or treated with the drugs listed above, the doctor may prescribe the following medications. Alpha-blocking agents. Alpha-beta obstructors. Vasodilators, blood vessel dilatants. Following the achievement of the ideal blood pressure level, the doctor may advise taking an aspirin every day to lower the risk of cardiovascular disease. To minimize the daily dose, the doctor may combine multiple types of medicine at a low dose rather than one type at a high dose. Taking 2 or more medicines at the same time is sometimes more useful than taking one type of medicine where the ability to choose the treatment is limited. The most effective or beneficial medicine combination is discovered through trial and error. High blood pressure prevention. The following are some techniques of prevention. Consume nutritious foods. Stay in a healthy weight range. Exercise on a regular basis. Avoiding alcoholic beverages. Non-smoking. Therapies that are not conventional. There are a number of food additives, sometimes known as complementary foods, that can help lower blood pressure, including linolenic acid, alpha-linolenic acid, psyllium husks, blonde psyllium. Calcium is an important mineral. Chocolate, cocoa. Cod liver oil is a great supplement. Fatty acids from the omega-3 family. The garlic cloves. The easiest method to get these nutrients into your diet is to eat foods that are high in them, but they can also be taken in the form of tablets or capsules. Consult a doctor before using such supplements while on blood pressure medication, as certain foods might reduce the efficiency of drugs and cause dangerous adverse effects. It is also possible to develop psychological peace and reduce stress by using relaxation techniques such as yoga or deep breathing. These relaxing techniques may help to reduce high blood pressure momentarily.